Bill's Prescription Center's motto is to treat people that come into our pharmacy as part of our family.
John Basil Noriega's family opened Bill's Pharmacy back in 1956 in Brandon, at a time when the city population was just 2,000 people.
They're family members, and they're also our customers.
To this day, it's the longest-standing Hispanic-owned independent pharmacy in Tampa Bay. But an unexpected threat may force him and other neighborhood pharmacies out of business.
8 or 9 different pharmacies that have gone out of business because of the PBM model.
The PBM, or pharmacy benefit managers, operate as a middleman between pharmacies and insurers. Initially, they were supposed to reduce healthcare costs and pass on savings to customers. PBMs work with commercial insurers and Medicare for its Part D benefit and with the Medicaid program. But as time went on, John says the PBM model started to change. They make their money from fees from supply chains and rebates from manufacturers and also from pharmacy spreads. That's the difference between what they pay for drugs from a pharmacy and what they get paid by the insurer, hence the middleman. But there's criticism that they're starting to play the system to make the most money for themselves, not for the customers, and ultimately forcing independent pharmacies to struggle because of bad pricing models.
And what's happening for us is we're buying something for $10 and they're paying us $6. But we actually paid $10 to bring it into our store.
There's also criticism that PBMs favor larger pharmacy chains.
They're trying to put small stores out of business, so CVS is the only place people can get their prescriptions filled.
Which is starting to create a monopoly in the pharmaceutical industry, one that caught Representative Jackie Toledo's eye.
Initially, they were there to lower drug prices, but they've contracted with certain pharmacies and forcing the little man out. And then ultimately, it's going to create less competition, less access to these prescription drugs. And then they're going to drive the cost of the prescription drugs up.
She created House Bill 961, making transparency key for PBMs, showing where their profits come from.
These PBMs are hiding behind private contracts. We just want to see how they're making money because we're paying for it. At the end of the day, taxpayers are paying for Medicaid and Medicare. So we need to see how that money is being spent.
We reached out to a few PBMs for their response. The Pharmaceutical Care Management Association responded on their behalf, saying House Bill 961 would cause health care costs to skyrocket for Floridians, their employers, and the state while lining the pockets of independent pharmacists. And claims that PBMs aren't transparent are false. PBMs support transparency for patients and their providers and health plan sponsors. In Florida, PBMs will save consumers and health care programs more than $43 billion over 10 years. And PBMs help the state Medicaid program save $2.3 billion.